Hello everyone, welcome to my channel. I am at Prachi. Today we are going to discuss about impedance audiometry. Impedance audiometry is an objective assessment method of the working of the middle ear. Before starting about this test, let's learn about ear. Ear is one of the main organ of our five senses, so carry its special importance in our life. Ear is not only what we see from outside, it is a pack of sound system seated deep inside our skull. So let's see how our ear structure is made up. Human ear is organ of hearing and equilibrium that detects and analyzes sound by transduction and maintains the sense of balance, that is equilibrium. Anatomically, ear is divided into three parts: outer ear, middle ear, and inner ear. The outer ear consists of the visible portion called auricle, our pinna, which projects from the side of the head, and the short external auditory canal, the inner end of which is closed by tympanic membrane, called as eardrum. This outer ear collects sound waves and guides them to the tympanic membrane. Middle ear is a narrow air-filled cavity in the temporal bone. It is spanned by a chain of three tiny bones: the malleus, that is hammer, the incus, that is anvil, and staps, that is stirrup, collectively called as auditory ossicles. This ossicular chain conducts sound from tympanic membrane to the inner ear. It is also called as labyrinth. Labyrinth is complicated system of fluid-filled passages and cavities located deep within the rock-hard petrous portion of the temporal bone. Inner ear consists of two functional units. First, the vestibular apparatus consisting of vestibule and semicircular canals, which contains the sensory organ of postural equilibrium, and the snail shell-like cochlea, which contains the sensory organ of hearing. The sensory organs are highly specialized endings of the eighth cranial nerve, also called as vestibulocochlear nerve. Now understand how this system works. Sound waves come in through your outer ear. They reach your middle ear, where they makes your eardrum vibrate. The vibrations are transmitted through three tiny bones called ossicles in middle ear. These vibrations travel to your inner ear and cochlea. It makes the nerve impulses that are sent to the brain, and your brain recognizes them as sounds. This is called as hearing process. This hearing process happens in healthy ear, but there are different conditions that can affect hearing or balance function of ear. One should always consult to ENT specialist if symptoms are like ear pain, impaired hearing, dizziness, vertigo or redness and inflammation of ear. At such symptoms, doctor suggests test impedance audiometry. Primary purpose of this test is to determine the status of tympanic membrane and the middle ear. And the secondary purpose is to evaluate acoustic reflex pathways, which include cranial nerves 7th and 8th and the auditory brainstem. Impedance audiometry is a painless and non-invasive but requires a small mobility during measurement. Probe tube is inserted into the ear and ended with cap. Probe cap inserted approximately 3 to 5 mm into the ear canal. Tympanometry is based on measuring the acoustic resistance and pressure in the middle ear. It is performed by changing the pressure in the external auditory canal to obtain such pressure that prevails in the middle ear. This causes the impedance of the middle ear to be smallest and the compliance of tympanic membrane is the greatest. Next is stapedius reflex test is performed automatically by providing middle and high frequency stimulus sounds, that is at 500, 1000, 2000 and at 4000 Hz frequency. Eustachian tube patency test involves inserting a tympanometer probe in the ear canal. It's the output pressure in the tympanic cavity being tested. Result of impedance audiometry is called as tympanogram. It gives values of the acoustic reflex on frequencies 500, 1 kHz, 2 kHz and at 4 kHz. Depending on the appearance and placement of the tympanometric curve, middle ear is evaluated as type A, that is of standard, type B total occlusion, type C partial occlusion. In type B and C, pharmacological treatment, physiotherapy, or surgery is recommended. This test is mostly dedicated to children having problem with speech impediment, ear pain, frequent infections, mouth breathing, snoring, or sinus obstructions and hearing loss. So definitely being very helpful tool for the people who have problem with hearing and speech. It gives a way towards perfect treatment for the problem which can make patient's life more comfortable. Thank you so much for watching till the end. Next time we will discuss about new topic. Till that keep learning, do your best. Bye bye.